Thank you for opening the video. Smile Trouble Consultation Room. Is there anyone currently suffering from depression? Even if you visit a hospital or clinic for depression and take prescribed medicine, your symptoms may not improve, or they may only improve while you are taking the medication, and then the symptoms may reappear as time passes. Are you worried? I created this video in hopes of providing hope to those who are suffering by providing information that will help them get out of those difficult days. Thank you. Depression is a condition where you feel depressed all day long and have no motivation or joy in doing anything. Mental stress and physical stress are often considered the underlying causes of depression, but depression can develop not only after painful experiences or sad events, but also after happy events such as getting married, going to higher education, getting a job, moving, etc. Even happy events can become stressful if there is a change in the environment. Therefore, everyone must be careful not to become depressed. In addition to psychological symptoms, various physical symptoms may also appear. Psychiatric symptoms include depressed mood, loss of motivation, anxiety, and irritability. Physical symptoms include headache, dizziness, tinnitus, sleep disturbance, palpitations, stiff shoulders, constipation, diarrhea, easy fatigue, and loss of appetite. It is important to notice your own symptoms early and treat them early, as well as to notice changes in other people as early as possible. If you notice signs of depression that can be seen by those around you, such as having a dark expression, blaming yourself, crying easily, slow reactions, restlessness, and increased alcohol consumption, it may be a symptom of depression. Please keep in mind that this may not be possible. Signs of depression that appear in the body include loss of appetite, lack of sexual desire, inability to sleep, sleeping excessively, feeling tired, getting tired easily, headache, stiff shoulders, palpitations, stomach discomfort, constipation, diarrhea, dizziness. If you notice any discomfort such as dry mouth, seek medical attention as soon as possible. We will discuss depression in more detail later, but first it is important to make sure that it is not an illness that requires immediate attention. If you have been diagnosed with no abnormalities, please read the following. The exact mechanism by which depression develops has not yet been elucidated. It is said that disturbances in the brain's neurotransmitters such as serotonin, noradrenaline, and dopamine are associated with mental and physical stress. When serotonin is deficient, the brakes are no longer applied to emotions and it becomes impossible to maintain a sense of normalcy. When norepinephrine is deficient, you become lethargic and lose motivation. A lack of dopamine leads to apathy, decreased sexual function, and decreased motor function. Other common causes of depression include genetics, stressful events, side effects of medications, and hormonal secretion abnormalities. Blood tests and imaging tests will not show any abnormalities unless the cause is a side effect of medication or a disease that causes hormone secretion abnormalities. Therefore, a diagnosis of depression is made through an interview with the patient, based on a variety of information such as the patient's symptoms and stories about their daily life. When it comes to treating depression, it is recommended to first rest your mind and adjust your environment. Depression is thought to be triggered by stress, so it is important to provide mental rest in an environment that is free from excessive stress. For example, if you develop depression due to an increase in your workload, you will need to take measures such as reducing your workload or receiving treatment at home. Next is drug therapy, which is described on the next page, so I will omit it here. Next, there is cognitive behavioral therapy, a type of psychotherapy. We aim to improve your symptoms through face-to-face conversations with doctors and clinical psychologists. When people experience strong feelings of hopelessness or self-doubt, cognitive behavioral therapy is used to correct the distortion between their thoughts and reality. The next treatment is electroconvulsive therapy. This treatment is performed when drug therapy, psychotherapy, etc. have not shown any significant effect, and the symptoms are extremely severe. The next treatment is transcranial magnetic stimulation therapy. For patients who do not respond well to drugs, this is a method of stimulating the cerebral cortex using magnetism and involves continuous, regular stimulation. Next, there is rework, a rehabilitation program for patients who have made some improvement through drug therapy, but are still waiting to return to work, and aim to get them used to commuting and working while attending daycare and other facilities. The mainstay of depression treatment is drug therapy, and the main drugs used are selective serotonin reuptake inhibitors called SSRIs, which have the effect of increasing serotonin levels in the brain. Other medications include serotonin and noradrenaline reuptake inhibitors SNRIs and tricyclic antidepressants. Antipsychotics may be used if the person does not respond to antidepressants. Additionally, sleeping pills and anti-anxiety drugs may be used to improve physical symptoms. The effects vary from person to person, and prescribed antidepressants are not always effective. It is also important to note that antidepressants usually take 4 to 8 weeks to take effect. A question arises here. The effects may vary from person to person, and even if you feel well while taking antidepressants or anti-anxiety drugs, if the symptoms reappear when you stop taking them, it may not be possible to treat the root cause. Probably not? Things that are said to be good to keep in mind in daily life include moderate exercise, getting enough sleep, eating a nutritionally balanced diet, staying away from stressful environments, and not spending too much time on the internet or playing games. It is said. Being mindful is important and can be a preventive measure, but for people who have already experienced severe symptoms, doing this alone will not provide treatment that will improve their symptoms. Therefore, in today's world where people with depression are overflowing with a variety of information, they must identify information on treatments that will be effective. If you are not feeling the effects of current drug treatment, or if you are not feeling the effects even after taking precautions in your daily life, think about neurotransmitters and learn about the functions of the brainstem. Although the exact onset mechanism of depression has not been elucidated at present, it is said to be related to disturbances in the neurotransmitters serotonin, noradrenaline, and dopamine in the brain, so selective serotonin reuptake called SSRI is recommended. Serotonin noradrenaline reuptake inhibitors and tricyclic antidepressants SNRIs are prescribed. Will my symptoms really improve if I don't take medicine? We need to consider whether there is a way to adjust neurotransmitters without taking drugs. Serotonin is also called the happy hormone and has the role of stabilizing the mind by suppressing the effects of dopamine and noradrenaline. It is a neurotransmitter in the brain that is biosynthesized from the essential amino acid tryptophan. The serotonin nucleus is located in the raphe nuclei group in the brainstem. Serotonin cell bodies exist here, and neurons extend to various parts of the body. Noradrenaline is a substance that is released as a sympathetic nerve transmitter or as a hormone from the adrenal medulla when the human body feels stress due to intense emotions or intense physical work. Dopamine is sent from the substantia nigra pars compacta in the basal ganglia to the striatum to suppress excitement. It is a precursor to adrenaline and noradrenaline. It is involved in the regulation of movement, regulation of hormones and circulation, learning, motivation, pleasure, and pleasure. The basal ganglia are a collection of nerve nuclei that connect the cerebral cortex, thalamus, and brainstem. The functions of the brainstem and areas connected to the brainstem are deeply related to neurotransmitters, which are the mechanism of depression. The diencephalon, which is the part of the brainstem that surrounds the third ventricle, contains the hypothalamus, which is the center of the autonomic nervous system and the endocrine system. After understanding the function of the brainstem, there are some symptoms of depression that we need to focus on. That is the stiff shoulders that I mentioned earlier as a physical symptom of depression. Many people suffering from depression have stiff shoulders. However, do you get stiff shoulders because you have symptoms of depression? It's not. Due to a certain cause, stiff shoulders and symptoms of depression appear at the same time. The cause of stiff shoulders is the real cause of depression. It's the neck. If you have a problem with your neck, it will affect the function of your brainstem. Since it affects the function of the brainstem, neurotransmitters are also disrupted, causing the mental and physical symptoms of depression. Symptoms of depression can be improved by properly treating the neck to normalize the function of the brainstem and secreting the right amount of neurotransmitters at the right time. For people who are not feeling the effects of taking antidepressants or anti-anxiety drugs, it is important to suspect that taking drugs may not be treating the root cause. For those who are not feeling the effects of current drug treatment, or those who are not feeling the effects even after taking precautions in their daily life, it is important to think about neurotransmitters and learn about the functions of the brainstem. The diencephalon, which is the part of the brainstem that surrounds the third ventricle, contains the hypothalamus, which is the center of the autonomic nervous system and the endocrine system. The hypothalamus controls the functions of internal organs and endocrine systems, and is the center of the autonomic nervous system that governs life. So if the hypothalamus becomes malfunctioning for some reason, it can cause not only the mental symptoms of depression but also physical symptoms will also appear. The real cause of depression is the neck. If you have a problem with your neck, it will affect the function of your brainstem. Properly treating the root cause of the problem, the neck, will normalize the functioning of the brainstem and secrete the right amount of neurotransmitters at the right time, which will improve the mental and physical symptoms of depression. If you would like to learn more about the neck, which is the real cause of depression, or information on neck treatments that can improve depression, please click on the URL of the Smile Counseling Room homepage in the overview section. There is no consultation fee. We look forward to your call. Well then, thank you for watching the video.